Dear friends, colleagues, and partners, as we come together to commemorate World TB Day, we stand in solidarity with the millions of people battling tuberculosis and honor those lost to this preventable, curable disease. We would like to salute all the health workers at the forefront of the fight to end TB and other diseases, including communities, civil society, and advocates, national TB programs, partners, and donors for their tireless dedication and support to the TB response. The fight against tuberculosis, the world's top infectious killer, is at a dangerous tipping point, with the progress now at risk. Drastic and abrupt cuts in global health funding threaten to reverse those gains. Rising drug resistance, especially across Europe, and the ongoing conflicts across the Middle East, Africa, and Eastern Europe are further exacerbating the situation for the most vulnerable. Early reports to WHO reveal severe disruptions in the TB response across several of the highest TB burden countries due to heavy reliance on US funding, with the WHO African region bearing the greatest impact, followed by the WHO Southeast Asian and Western Pacific regions. 27 countries are facing crippling breakdowns in their TB response, with devastating consequences. Human resource shortages are undermining service delivery. Diagnostic services are severely disrupted, delaying detection and treatment. Data and surveillance systems are collapsing, compromising disease tracking and management. Community engagement efforts, including active case finding, screening, and contact tracing, are deteriorating, leading to delayed diagnosis and increased transmission risks. Several countries report failing TB drug procurement and supply chains, jeopardizing treatment continuity and patient outcomes. The 2025 funding cuts threaten to worsen an already underfunded global TB response. In 2023, only 26% of the $22 billion annually needed for the TB prevention and care was available, leaving a massive shortfall. TB research is in crisis, receiving just 1/5 of the $5 billion annual target in 2022, severely delaying advancements in diagnostics, treatments, and vaccines. WHO is leading efforts to accelerate TB vaccine development through the TB Vaccine Accelerator Council, but progress remains at risk without urgent financial commitments. The theme of World TB Day in 2025, Yes, we can end TB, commit, invest, deliver, is a bold call for hope, urgency, and accountability. It urges high-level leadership, increased investments, rapid implementation of WHO recommendations, and multi-sectoral collaboration to drive progress and turn the tide against the TB epidemic. In the lead-up to World TB Day, the World Health Organization is calling for action on several fronts. First, WHO is urging immediate acceleration to transform secured commitments into decisive action. Heads of states at the 2023 UN High-Level Meeting on TB made bold, ambitious commitments to accelerate the global fight against TB, setting concrete, measurable targets for 2027. While these pledges represent a significant milestone, sustained and intensified action is critical. Scaling up interventions requires strong policies, comprehensive national strategies, and substantial financial investment to drive impact at global, regional, and national levels. We at WHO are committed to providing crucial leadership and technical support to countries to bolster their TB response. Second, WHO is calling for increased and sustained strategic investment to accelerate the TB response and advance critical research. Sustained investment in resources, support, care, and information is essential to achieving universal access to TB care and advancing research. These investments will drive significant improvements in health outcomes and save millions of lives. Third, WHO is calling for urgent action to deliver on commitments by rapidly accelerating the adoption of WHO guidelines. Turning commitments into real, measurable impact for people affected by TB demands more than investment. It requires bold, decisive action. This means rapidly scaling up to WHO-recommended interventions, including early detection, diagnosis with rapid tests, preventive treatment, and high-quality TB care, especially for drug-resistant TB. Achieving this at scale requires a whole-of-society approach that not only strengthens healthcare systems, but also creates safe, supportive environments where prevention and treatment can be delivered effectively. Fourth, WHO strongly urges coordinated action from sectors, communities, and civil society to drive a powerful and united front against the epidemic. A unified multi-sectoral response is essential to dismantling the key drivers of TB epidemic: poverty, inequity, undernutrition, comorbidities, stigma, and discrimination, barriers that extend far beyond the health sector. Sustainable progress hinges on strong accountability driven by community leadership, powered by civil society, and reinforced through cross-sector collaboration. WHO is leading the charge to push for systemic change and inclusive policies that guarantee every individual, no matter their circumstances, has the opportunity to receive the care, support, and protection they deserve. All these joint actions are essential to driving the TB response, saving lives, and achieving global TB targets. The next few years will be pivotal in the fight against TB. At WHO, we are unyielding in our commitment to the millions affected each year. No challenge will deter us. We will continue to provide strong global leadership as mandated by member states, working with all stakeholders to ensure no person, family, or community is left behind in the fight to end this deadly disease. TB is an urgent crisis, but one we can end if we act now. The cost of inaction is measured in lives, and we can't afford to lose any more. Join us. Together we are stronger. Commit, invest, deliver. Together, yes, we can end TB. Thank you.